So what kind of tissue is bone? Osseous tissue, or give me a category that we just discussed. It's connective tissue, right? And what kind of extracellular matrix does this connective tissue have? It's a solid made of lots of what? Who? It comes from cartilage, actually. Calcium, magnesium, lots of fibers, lots of ground substances in this connective tissue. That's what makes it solid. There's different structural types. We can have a skeleton, that's your structure, that's the hard stuff, the osseous tissue. And the skeleton is actually broken down into sections. This is a nice diagram because there's pretty colors that show us all the different things that are part of your skeleton. So we have skeleton, the part of your skeleton that kind of, if I took a metal rod and rammed it through the top of your head and ran it down your spinal cord, that would really hurt. And everything in your skeleton that hung off of it, we'd call it the axial skeleton. So in the diagram you can see this darker color. There's your spinal column, your, what's that thing there? That's your rib cage. Then you have your, what's that thing on the top? The skull, the cranium. So that's all part of the axial skeleton. Everything that hangs off of that, that's called your appendicular skeleton. And very important parts of the skeleton is actually not bone, but cartilage. So they talk about some of the different cartilages that help bones to join together and allow for movement. Now, what causes you to move? Is it bones? It's muscles. Muscles pulling on bones. So bones kind of have to do what? Well, they have to be stiff to be pulled on and move your hand, for example. But they also have to move across each other. So places where we're going to see some sort of movement, we're going to see cartilage. So we have articular cartilage, like this stuff, the blue stuff. What kind of cartilage is that? Hyaline cartilage. Remember that one? It kind of looked like a skating rink with holes in it where the cells lived. What were those cells called? Chondrocytes. And they lived in the little holes. What were the holes called? Lacunae. Yes? So that hyaline cartilage can be found in places where what? See what I'm doing? So we find those on the ends of bones where bones meet each other. We can't say that in science. What's the word I'm going to use for where bones meet each other? They're freely moving ones are synovial, but what do we call that meeting? One bone to another. I'll give you a hint. It's called articular cartilage. When one bone meets another, they don't meet each other, they articulate. Okay? So where we see the bones meeting each other and moving, we see articular cartilage. Costal cartilage, where's that? Also hyaline cartilage, costal cartilage. Yeah, in the rib cage. Now, what do I have to do here? It's bones, ribs, spinal column, sternum, create the rib cage, but I need to allow for what? Yeah, a little expansion and relaxation when I do what? When you breathe. So if the connection between ribs and sternum was a tight connection, would I be able to expand my rib cage? No. So we have cartilage there called costal cartilage. Then we also have respiratory cartilage. the larynx, the voice box. That's cartilage in that area. You know your Adam's apple? Is that bone? It's cartilage. It's real thick cartilage that surrounds your vocal folds. And then we have nasal cartilage. Where's that? Yeah, up in the nose. Now this is what kind of cartilage? Elastic, but behind it, a little more stiff. We also have the ear, which is elastic cartilage as well. So they describe some of those different cartilages. The other one they describe is something called fibrocartilage. Now fibrocartilage is what? Yeah, it's got a lot more what in it? Fibers, exactly. And we find it in places where we want a little bit of movement but not a lot of movement. So places like the pubic symphysis that holds your two coxal bones together to create your hip bones. And between the vertebrae, so you can do this, but we don't want too much movement between those bones, because what we're going to see when we discuss the nervous system is nerves feed into that cartilage and into the spinal column. So we want to create a separation, but we don't want to do what? Yeah, we don't want to squish all those nerve endings. If anybody has a slip disc or a problem with those, you'll understand why that's not good. Can cause a great deal of pain and problems with nerve function. So we don't want to do that. Fibrocartilage. So these are the cartilages associated with our skeleton. Bones are constantly growing. Did you know that? So you're constantly making and breaking bone. We're going to talk about that in this chapter as well. We have growth this way, constantly. Appositional growth this way. As I grow the bones, I'm going to break them down that way as well. Constantly remodeling the bones. When you're little, are your bones as big as they were or as long as they were now? No. So what did your bones have to do? They had to grow in length. Bone, we're going to see, comes from cartilage. So in the very beginning stages of embryonic development, you are starting to form your skeleton. You form that from cartilage-like cells, which will then turn into bone. So bones are classified in different ways. We have, again, the axial skeleton, the appendicular skeleton. We're going to discuss those, especially in lab. And are you going to learn all of the bones? Yes. There's 206 of them for your learning pleasure. The nice thing is there's some duplicates. So it's not 206 separate things you have to memorize. So it's not too bad. And believe it or not, most of you know a lot of them already. People tend to be more familiar with the skeleton than they are with the muscular system. So it's not going to be as bad as you think. And when we're in lab, it'll be fun to learn them. So we have different classifications depending on shape. So long bones are longer than they are what? Longer than they are wide. One of the examples up there, does anybody know what that bone is? It's in the upper arm. Ha ha ha. It's called the humerus. We have flat bones. Good example is your sternum. Another example is bones in your skull. Your skull isn't one bone, you know. It's a whole bunch of bones. They're flat bones. I like to describe them as a bone sandwich. There's two types of bones we're going to discuss, compact bone and spongy bone. And when we look at a flat bone, it's like a bone sandwich. The bread part of the sandwich is compact bone, and the inside of the sandwich is what? Spongy bone. So we have flat bones like the sternum. Then if we have something that's short and pudgy, kind of cubic shaped almost, we call them short bones. An example of a short bone is the talus, which is that big heel bone, which we'll talk about later. And then anything that doesn't fall into the other three categories, we're going to call what? Irregular. So what is that? That's a vertebra. And we are going to talk about them when we discussed your vertebral column. So those are irregular bones. We also have bones that kind of hang out in places between big, long ligaments and tendons. What's a ligament and a tendon? One attaches muscle to bone. Which one? Tendons. And one attaches bone to bone. Ligaments. Okay? Those are actually going to create a pull. When I create a pull on a bone, I'm going to see it's an area that becomes a little thicker. Because that stress makes your bones grow. How can you make your bones stronger? Weight-bearing exercise. That stress is going to cause you to make more bone matrix. Okay? So if you have problems with not making enough bone matrix, and we're going to see that defined at the end of the chapter, what's that called? Osteoporosis. You break your bones faster than you make them. You're going to join the boys cleaning up the lab, cleaning up the room at the end of class today? You're going to join the boys to clean up? Okay, good. That stress is going to cause you to make more bone. All right? So, stressing your bones actually makes them stronger. Also, the proper nutrients. You've got to have the ingredients to make the bone matrix. What's the bone matrix made of? Calcium, magnesium, phosphorus, to say a few things. So, what are bones for? Support. Imagine you without your bones. Yeah, you'd kind of be a snake, right? Protection for your brain. Protection for your heart and your lungs. Protection for your spinal column. So protection is another thing. Movement. They don't really move, but they get pulled on for you to move by the muscular system. So they're extremely important for movement. Minerals and growth factor storage is another very important thing bones are used for. What kind of minerals? Calcium, magnesium, phosphorus. What the heck do I need all those things for? Not just for bone, but we're going to talk about them so many times in this class. Calcium, for example. Calcium's extremely important for muscle contraction. Calcium's important for nerve impulses. When I don't have enough calcium floating around in the circulatory system, guess what I'm going to do? I'm going to go get it. Where am I going to go get it from? The bone matrix. So I'm constantly building it, so when I have some extra calcium on hand, hormones are going to help me take that extra calcium and lay down some bone matrix. When I don't have enough calcium, I'm going to go and break down the bone matrix so that I can release it back into the circulatory system. Blood formation. What? Blood formation? Bones make blood? Does anybody know what's in bones that help make blood? Bone marrow, specifically red bone marrow. And this is where we're going to find the precursor cells to all of the blood cells that you have. You have 5 different types of white blood cells, red blood cells, and little fragments of cells called platelets. And they all come from the cells that hang out in red bone marrow. We'll talk about that second semester. We also store, believe it or not, fat in our bones. In the long portion of long bones, we're going to talk about in a moment, we store fat, and that's called yellow bone marrow. You've probably seen, anybody have a dog that you buy marrow bones for? My dog loves me when I come home from Ballard's with a bone. But what that is long bones that the butcher has actually cut. And what you can see in the center is that yellow bone marrow. It's fat, and dogs love it. Hormone production. Bones are going to help produce certain hormones that help to regulate bone formation. They also, believe it or not, protect against certain things like obesity, glucose intolerance, and diabetes. So we'll talk about some of the osteocalcin hormones when we talk hormones next semester in chapter 16 when we talk about the endocrine system. So that's some of the reasons why bone is important. Now let's look at the structure of bone. So with respect to gross anatomy of the bone, we're just going to do a quick overview here. You're going to see this diagram again where? Lab exam number 2. Everybody's ready for lab exam number 1 today, right? Or this week? Going to get 100, right? All right, so what we have is 2 different types of bone, 2 different structures of bone. If I look at the histology of bone, and that's what I'm looking at here when I describe the 2 terms, I'm looking under the microscope at this kind of bone and that kind of bone on the edge. We have something called compact bone. It's very tightly packed. It looks like little tree rings almost in the way it grows. And then we have stuff called spongy bone or trabecular bone. That tends to be at the ends of long bones, and we happen just to be looking at a long bone here in this diagram. But when we look at flat bones, we're going to see a combination of the both. And again, my description of bone sandwich, compact bone on the ends, spongy bone in the middle. When we look at a long bone, there are sections to it, the ends and the middle. The ends of bones are called what? Long bones. Epiphysis. Now we have a proximal epiphysis and we have a distal epiphysis. You know those terms, right? What's proximal mean? Closest to the what? To the midline, yes? So that bone happens to be, I kind of know what it is. Do you know what it is? It's a humerus. We'll talk about how come I know that when we look at some of the different characteristics of a bone. The proximal end is where? This is the humerus. Where's the proximal end? Where's the distal end? Yes? So proximal, remember I said you had to know these terms? Anybody read this chapter? Yeah. And you see why? Because it speaks in that language now. So now that you know that language, you can read freely and not be confused. The diaphysis, that's the long part in the center. At the ends, the epiphysis, both proximal and distal, we're going to see more spongy bone, more trabecular bone. On the ends of the bones, we also see what kind of cartilage? What kind? Articular hyaline cartilage. And that's going to help the bone move across some other bones at their articulations. We also see coverings on the bone and places where blood comes in. Why do we need blood? You got to feed the bone cells. Remember when we looked at tissues, we saw there were cells that made up bone. So in the diaphysis of a long bone, we're going to see a big space. That's called the medullary cavity. And it's filled with what? Yellow bone marrow. What's yellow bone marrow? Fat. Triglyceride storage. Around it, we're going to see compact bone. And then we're going to see the covering of this particular organ called the what? Osteum. Peri means what? Around the osteo bone, periosteum. Do you ever make roasted chicken? Sometimes you break the bones and you can almost pull this kind of like paper-like thing off the bone sometimes. That's the periosteum. Those little Sharpies fibers is what you see, that little whitish stuff that you're seeing when you try to pull that off. What we're going to see is also holes in bone. There's different very specific holes in bones. We'll look at real bones in the lab, and we see that some of them have holes in them. Holes for where major arteries and also nerves feed into our bone. The major artery that helps to feed any given area of bone is usually referred to as a nutrient artery. And we'll see markings on bones, holes on bones, where they actually feed into bone. So we have an epiphysis, we have a diaphysis, we have a membrane that surrounds it, the periosteum, and we have a membrane that actually lines the inside cavity called the endosteum. And then we also have little holes where arteries feed in. In your book, they're described as nutrient foramina. Foramina means what? Hole. There's different markings on bones where different things happen. Either muscles attach or another bone sits up against it and rubs against it. And these markings we're going to have to know as well from this chapter. So there's your first bone marking you just learned. Foramina means hole. There's a big, huge hole at the base of your skull where your spinal cord feeds in. Do you know what it's called? The magnum foramen magnum. Big hole. That's what it means. Okay? So, red bone marrow we're typically going to find in the little spongy spaces of spongy bone at the ends of bones and in flat bones. And ever look at a sponge at home? If you get really bored, go look at your sponge. It looks like that, doesn't it? Kind of little pores and holes where the water feeds in. So spongy bone is the same way, and those little pores and holes is where you're going to find red bone marrow. So that's where we find hematopoietic tissue. And what's hematopoietic mean? Yeah, it's making blood cells, hemo, blood. So this is red bone marrow and where red bone marrow lives. Bone markings. If you look on page 180, table 6.1, guess what? Know them. So again, bone markings are different things. We see little thick areas on bone, little holes in bone, little projections, things that stick out of bone. All of them have certain names. So you have to know what? A tuberosity, a crest, a trochanter, a line, a tubercle, an epicondyle, a spine, and a process. A head, a facet, a condyle, a ramus, a groove, a fissure, a foramen, a notch, a meatus, a sinus, and a fossa are. Yes? And where is that? All that information going to be? On that chart, 6.1, page 180. So do you have to know it? Yes, you do. And those, again, are all called bone markings. When we look at the microscopic anatomy of bone, we look at the players who actually form and maintain and break bone. So different types of cells are going to help create bone. Osteoblasts, osteocytes are some of the familiar ones you might have heard. These all come from a stem cell called, or some of them do, not all of them, I shouldn't say that, come from an osteogenic cell. That's the beginning of bone. So bone is formed from osteogenic cells. Originates from an area, and I think I described this to you during embryonic development. How many cells do you come from? One. And once that cell starts reproducing itself, it's going to start to form different layers. So in the very beginnings of you are layers of cells. And the layer that bone comes from is what? It's called begins with an M, the mesenchyme. We talked about this when we talked about connective tissue, remember? Okay, so it comes from the mesenchyme. Osteogenic cells, osteoprogenitor cells. This is where bone comes from. We're going to talk about different types of bone formation in a moment. Osteoblasts, these are actually bone forming cells. And what part of the bone am I talking about? The hard stuff, the matrix stuff. Osteoblasts are cells that actually create the material that they then sort of spit outside themselves and create those growth rings, the bone marrow spaces, the compact bone setup. So osteoblasts are bone forming cells. Now at some point, we don't want to block off our food source as an osteoblast. I'm going to stop doing that. And I'm going to become what? A bone maintaining cell. So osteocytes are bone maintaining cells. They're described as mature bone cells. And they're going to be in those little spaces, the lacunae. The other type of cell comes from, and I don't think this is in your book, but it comes from the circulatory system. It comes from a cell called a monocyte. And when you start getting low in calcium and you need to get some calcium from your bones, the monocyte is actually going to squish out of the circulatory system and turn itself into what? A bone-breaking cell. What cell is that? The last one on the list. Osteoclast. So osteoclasts actually come from the bone marrow. They were monocytes, and when they squeeze out of the circulatory system, they turn into what we call macrophages. And they switch over to become osteoclasts. This is all hormone driven, causing the cell to do something different. And they're going to actually help break bone. So bone grows out this way and then gets broken down that way. So your bones today are going to be totally different bones in 10 years. They're going to look the same because of what? You constantly making them and breaking them. And that's what we're going to discuss when we discuss remodeling. So when I look at the histology of bone, and there's my little bone sandwich. You see what I was saying about the... Doesn't it look like a bone sandwich? Use your imagination. What kind of bone is that? Well, in the middle, spongy. On the outside is compact. What kind of bone is it? Flat bones. Oops, wrong way. Where'd I go? What am I doing? There I go. So what we're going to see is bone forms itself around its food supply. Its food supply is arteries that kind of run through the center. And we saw this when we looked at tissues, right? We saw that central canal, that big hole in the histology slide. And then all those little rings that formed around the central canal. They were called lamellae. Now those rings are going to form themselves going in many different directions. Anybody ever make a rope or use a rope to tow something? If I had a rope where all the fibers were going in one direction, would that really do me any good? No. What would happen? Why would it break?
Because of the stress.
Yeah, it would stretch and snap. So ropes are what? Yeah, they're twisted. They like braided so that the fibers go what? in all different directions. So that gives it what? Strength. Tensile strength. And that's what this shows us. That's how your bone is formed too. So all those little layers don't all go in the same direction. They go in opposite directions, just like a braided rope. Those collagen fibers going in different directions are going to help give the bone strength. I used to show this neat movie in lab many, many years ago where they have a femur and they actually balance a Volkswagen on it. So your femur can take that much weight because of the fact all of these fibers are going in different directions and they can take that strength. Now, sometimes everybody's like, well, I knew somebody that broke their femur and it really wasn't that traumatic. But if you hit it just the right way, you can break it. Just like a diamond. If you hit it just the right way, you can break it. So, bones do break even though they're really, really strong. So we have combinations of those rings. Interstitial and circumferential lamellae is what's described there. We also have little units called osteons. So when I look at this slide, I'm going to see some of those terms. So we see that there's a blood supply, and that's what those little wires are. The red ones are arteries, the blue ones are veins, and the yellow ones are what? Nerves. And they run through those central canals. We see that great nutrient artery feeding in and going this way. What's this way? Horizontal and vertical. So we see canals inside the bone that are supplying blood and all that good stuff to all the bone cells going horizontally and vertically. The ones that are going horizontally are called Volkmann's or perforating canals. And the ones that are going vertically are called nobody? Central or Haversian canals. Okay? And that's where our rings are going to grow around, those central canals. So I can pull out that little contraption that we saw before, rings growing in different directions in little sections. Those little sections growing around the central canals are called osteons. And you can see them. They're so clear under the microscope. When we do microscope work next week, you can see them. They look like little tree rings growing around that central canal. Those are called osteons. As they keep growing out, and that's how they grow from the center out, we're going to see that some of those rings start to become a little bit irregular on the ends. Those are called circumferential lamellae, the ones on the what? The circumference or the outside of the bone. When we take a close look at the osteon here, so I've sucked one out and take an up-close look down here, I see my blood supply, artery, vein, I see nerves, and then I see the cells. So what are these little cells called? They're the bone-maintaining cells. What are those called? Osteocytes. Now remember, I need to have some sort of way to get to my food supply. So we see through the lamellae these little lines or little canals. Little canals. You know what they're called? Canaliculi. You know what canaliculi means? Little canals. Exactly. So we see that through the bone formation. Now, there's no good stuff left in here. This is kind of bone that doesn't have any organic material left in it. No live cells. But the live cells would be where? In all those little spaces. What are those spaces called again? Lacuna. So this is what you are familiar with from studying tissues. So we see these dark spots are where our osteocytes live, and then those rings are called lamellae. Yes? So interstitial lamellae would be the ones closest to the what? It's closest to the central canal. And the circumferential lamellae would be the ones what? On the external or further away from that central canal. So, bone is made of inorganic and organic substances. What's an organic substance? Say who? Carbon-containing substances. So, osteoid is a term used for the carbon-containing organic materials that we find in bone. The inorganic materials, which is about 65% of the mass of a bone, is also very important. And we talked about those already. Calcium, magnesium, phosphorus. They are very tightly packed and they are very hard and strong. When you die, your bones die too. Now, normally we're supposed to, when we die, where are we supposed to go? Back into the earth, yes? And what's supposed to happen to us? Decomposition. So decomposers in our environment should break down and reuse what? All of the material, especially the organic material that we have in us. The inorganic bone, though, takes a way, way longer time to break down because of the fact it's so tightly packed. So it's left behind a lot longer than all of the organic material that we're made of. Will those eventually break down too? Yes. Under certain circumstances, though, because they're hanging around a long time, they might get caught up in different layers of decomposing earth that build on top of them for many, many years. You see where I'm going with this? And they might actually create an imprint of them that they leave behind for somebody who's walking through the stream to find one day. What's that called? A fossil. So that part, the inorganic components of bone, will be around a lot longer than the organic compounds or components of bone. But we still have both. So bone is living, the cells, the osteoid that make up bone. The process that makes up the hard part of bone is called ossification or osteogenesis. And that's the formation of the matrix, the strong stuff, where the cells are eventually going to live. Now, oh my goodness, this would make a lovely essay question on your next exam. There's two types of ossification. In the beginning, your bone is going to come from that layer called the mesenchyme. So in the beginning, we see bone cells starting to form. They form a group of cells that start to differentiate. And remember, you came from one cell. So all of the cells that come from that one cell are not the same, correct? Something causes them to change into something else. That's called differentiation. And those beginning cells have the ability to differentiate themselves. As your cells sort of establish themselves and get older, they no longer have the ability to differentiate themselves. So, ossification center appears in the fibrous connective tissue membrane. So we start to see those very beginning bone cells. They're then going to start doing the osteoblast thing. And remember what osteoblasts did for a living? They start spitting out matrix around themselves. So bone matrix or osteoid is secreted in the membranes. And we start to see the beginnings of our bones. When they become trapped, they turn into what? osteocytes. So ones on the outside will start doing that as well. And we'll keep doing that, working from the inside out to create bone material. Once we've created a nice base of bone material, we start creating spaces and blood vessels to do what for that growing bone? Feed it, exactly. So woven bone and periosteum form. So we start to see the vascularization of bones. All the bone that forms in the beginning looks like spongy bone, or what do we call it here in this little description? What's another name for spongy bone? Trabecular bone. So trabeculae, that's the little spongy looking formations, is what we call those formations in spongy bone.
Now, when a baby's born, there's pretty much a lot of them is the spongy bone still.
Now, a lot of them is actually cartilage still.
Oh,
So if you look at, I think, if you look at an x-ray, oh yeah, there it is. Look on page 194 in your textbook. What you're going to see, and this is, what is this, 12-week-old fetus. So this is, how many weeks does it take to make you? 40 weeks. So we're only 12 weeks in when we start to form these bones. And it looks like there's tons of spaces. Best place to look is in the hand. Now, what are all those white spaces between all the bone? Cartilage. Okay? So when you're born, you still have quite a bit of cartilage at the ends. And that's going to allow your bones to grow in what? Length. You also have a lot of cartilage up here in the cranial cavity. They're called fontanelles. They'll eventually do what? Form bone and hook like this. So, okay. So then we start seeing compact bone come into play. And that's going to be what we call the bone collar. And we're going to start to see the structure that looks more like long bones forming in that fourth step. So lamellar bone, those layers start to form, and the compact bone formation comes into play. Spongy bone, or diploe, is also still present, but will eventually become the familiar osteon that we see in compact bone. So, endochondral ossification in a long bone. We see it here in this diagram. And we see how the bone, through these steps, which also would make a nice essay question for you, are put out for us a little bit differently. So the bone collar has to form, and we sort of build around it. Has anybody ever made pottery, used clay and made pots? What's one of the ways you start forming your pot? You just plop that clay on there and just let it spin around and pat it. How do you start to form a pot? You have to take your hands, create a pressure to start forming things on either end, to make it start to make it tall, right? That's what's happening when you make the bone collar. You start to lengthen the bone growth and make it tall. So this is the formation of a long bone, basically. And this is the process of endochondral ossification. You can see this diagram on page 184 in your textbook, figure 6.8. Everybody with me? So go through those steps, understand those steps. The next thing the book talks about is some of the different areas that we're going to see during bone formation. Now, when I look at a bone, a long bone that is mostly formed through the ossification processes we talked about, it's still not done yet. So just think about you being born. You had all your bones, but you're not done yet. Because what do you have to do? You have to make those bones longer. Now, of course, they're going to go wider, too, because you keep doing that through your whole lifetime. But you have to make them longer. The place where you're going to make them longer is called the epiphyseal plate. Anybody have kids? Sports? Anybody ever have a fracture at the Yeah. It's real common in young people because that's a sort of a weak point in your ends of your long bones. Because it's still what? Cartilage. So what we see here is different zones that form to form new bone, to lengthen bone. So we have the proliferation zone, which is cartilage, looks kind of like a little bit more organized hyaline cartilage. Then we have the hypertrophic zone. Then we have the calcification zone. Then we have the ossification zone. So it goes through these different steps to eventually lay down bone matrix and form compact bone and lengthen bones for growth. So if we look at long bone growth and remodeling during youth, we're going to see that growth takes place there at the epiphyseal plate. Do you have an epiphyseal plate? Not anymore. How do I know you don't have one anymore? You stop getting taller, yes? When you stop getting taller, and when does that happen? It's different for everybody, right? So certain people will grow for longer periods of time, but when you stop doing your thing, and by the way, women do it faster and stop earlier than men. So when I was in 5th grade, I was like the giant girl, right? You're taller than everybody in the whole class. And then that was it for me, 5th grade. And everybody else started growing up. Do you see what I'm saying? So women tend to grow in length faster and stop earlier than men do. And that's where we're going to lengthen at the epiphyseal plate. That will eventually turn into bone when you're done your growing. And we won't call it an epiphyseal plate anymore. We'll call it an epiphyseal line. Because there's going to be a little area left behind where all that growing was happening. And you can actually see it in an X-ray. So who's going to regulate all of this stuff? Who's going to tell the cells this is what you have to do and this is how fast you have to do it? Who does that in the body? Hormones. So there's a couple of different directors in the body. One of them is the nervous system, and the other one is the endocrine system. So all this cell direction, this is what you have to do and this is how fast you have to do it, is under hormonal regulation. And that's what they talk under hormonal regulation of bone growth. So this is one of those what mechanisms that you've seen forever and ever already. Yeah, but what kind of one is this? Feedback mechanism. Negative feedback mechanism, very good. So this is an example of a negative feedback mechanism in hormonal direction. What's she talking about? What's happening here? We have to maintain a certain level of what? So the homeostasis we're talking about in this case, in this feedback mechanism, is what? Calcium. What is it? What's the norm? That's at the top. That's the balanced seesaw. 9 to 11 milligrams per 100 milliliters. I'm not going to make you memorize that. Don't panic. So that's balance. Now, what happens? Who ate breakfast this morning? Very good. Who didn't eat breakfast this morning? Oi! What do you think's happening to your calcium levels? Now, in order to muscle contract, nervous system to work, you need calcium. You need enough that's being delivered by the circulatory system. So if you didn't eat breakfast this morning, what are you going to do? You're going to die. No, because your body's going to take care of that for you. How is it going to do that? Falling calcium levels. That's the imbalance. I got to get calcium more back into the circulatory system, even though you didn't bother to feed me this morning. Where am I going to get it from? I'm going to get it from your bones. And who's going to help me? The parathyroid glands. It's going to release a hormone called, this is a good one, parathyroid hormone. Thank you. Something that finally makes sense. So what's parathyroid hormone going to do? Bring calcium levels back. How? It's going to get into the circulatory system, and who happens to be floating around in the circulatory system? The monocytes, right? Remember those monocytes I talked about? They're going to be like, oh, parathyroid hormone, I guess I have to go do another job. It's going to stimulate them to differentiate into who? Osteoclasts. So I'm going to squeeze out of the circulatory system. I'm going to become a macrophage, specifically an osteoclast, and I'm going to go do what? Yeah, break down some of that bone, break down bone, and release it where? Back into the circulatory system. Guess what happens to my seesaw? Whoop. Back to normal. Balance. Yes? Negative feedback mechanism, decreased calcium levels, parathyroid hormone, increased calcium levels. Increase calcium levels by stimulating who? Osteoclasts to break down bone. Okay? So what happens the other way? Say I go to Friendly's and I enjoy ice cream quite a bit. Unfortunately, as I get older, ice cream doesn't enjoy me anymore. But what's there a lot of in ice cream? Calcium. So I eat my calcium, right? That was my excuse when my children were developing. I must help them with their bones. And I ate quite a bit of ice cream during my pregnancy. I still blame my youngest daughter for the extra weight that I have due to the extra ice cream that I ate. She's 20. Is it still a valid excuse? I guess not. Yeah, well, I still try. So anyways, I go to the Friendly's and I eat lots of calcium. Now what happens to my seesaw? What am I going to do now? Store it, exactly. So I'm going to do the opposite. I'm going to stimulate those osteoblasts to do what? Suck in all that extra calcium and create bone with it. There's another hormone called calcitonin. Calcitonin is made by the thyroid gland. And basically what it's going to do is say, hey, parathyroid hormone, cool it. So that the osteoclasts can do what? Osteoblasts can do what? Take up that extra calcium and store bone matrix. So the two are going to work hand in hand to help model bones, form them, break them down. So the next part of the book talks about bone homeostasis, remodeling, and repair. So osteoid cells, osteoid seam, is where we're going to make bone, deposit bone. Bone reabsorption, those osteoclasts are going to help me break down bone. And they're going to work together to help model bones. Hormones that you need to know are parathyroid hormone and calcitonin. Some other hormones, some hormones that are released by adipose tissue like leptins are also going to help regulate bone density as well. Another thing that's going to stimulate matrix formation from those osteoblasts is stress on the bone. And this is where you couch potatoes might have a problem as you get older with not having a good strong bone matrix. So mechanical stress, when I walk, when I pick things up, They stress bones. They pull on bones. Your tendons pull on bones. Your ligaments pull on bones. And that's also going to stimulate what? Bone formation. So they talk a little bit about response to mechanical stress in your textbook. And that's going to help create the hardness of your bones. And also, even if you look at the femur, when you go to lab, when you look at the femur, that big, long, which is the longest, strongest bone in your body, it's not straight. It's got a little curve to it. So your weight, gravity, and the weight that you hold every day gives a little curve to the bones. That curve is actually better than having something straight up and down. It's a less chance for it to snap. Also, trabecular bone is going to help with sort of the cushion that allows you to walk. Anybody have any little inserts in their shoes like Dr. Scholl's gel inserts? Are you gelling? Yeah. But why are those good for?
I have fasciitis and I work at CMMC, so
You're on your feet all the time, and what do they help you with?
they help support.
They support you, and they also help to relieve some of the pressure on your feet. So your spongy bone is going to help that inside your bones as well. Wolff's Law explains the featureless bones of the fetus. Don't worry about that. Hormonal control is very important in remodeling. And again, parathyroid, calcitonin. Who's that? Oh no, that's not her anymore. Venus used to be on our book at one point, the famous tennis player. And if you look at the diameter of this tennis player's serving arm versus her non-serving arm, the bone will look very different. How come? And actually, her muscles will look very different too. You ever notice a tennis player? They have one really thick arm. It's because the stress actually causes the diameter of the bone to be larger. So, one of the other things I need, oh wait a minute before I get too far, common types of fractures. Do you have to know those? Yes, you do. So we can have comminuted, compression, spiral, epiphyseal, and that's where those little kids sometimes pull that cap off the top of the bone from the epiphyseal plate. Depression and green stick. There's also a compound. What's a compound fracture? That's the nasty one where it sticks out of the body. So know your different types of fractures. And then the last part of the text talks about bone repair. Also a lovely essay question possibility for your next exam. So know the different types of fracture classifications. Basically, when I try to repair bone, what I want to do is make sure everything lines up the best that it can in the organization that it used to be in. So if I get little pieces, what do I want to do with the little pieces? I want to bring them back together and try to hold them there, put sort of a fake bone collar. Remember when they formed in the beginning? We want to help get them to make more bone and form more compact bone and more bone matrix by holding them together with a fake bone collar. So sometimes we go and we get a cast to hold everything together and in place. If that's not going to do the job, what else can we do? Yeah, we can go in there and we can put metal in there to kind of hold everybody in place.
I have one on both hips to both knees.
Yep.
Because of my car accident, this was 50 something pieces down here.
Yep.
And this is a 4-inch chunk that was knocked out of my leg.
Yep. So we have to get everybody back together. Everybody lined up together. When we talk about the integumentary system, we're going to talk about that again when we cut ourselves. Because when you cut yourself, you separate the cells in order for them to do their thing, grow back together. And we know bone can do that because it's constantly growing, right? We have to line it back up so they touch and they fix their break.
I have a quick question.
Yep.
About the integumentary break. It said that you have a scar for every time you
Yep.
cut yourself. So even if you can't see it, it's there.
Yep.
Okay.
You can see it microscopically. So every time you make yourself bleed, you have a scar. You have a bigger scar that you can actually see visibly when you cut yourself big. You know, and again, think of my sock repair analogy. If you have a little tiny hole in your sock and you only need a couple of little threads, you might not even notice it. But if you have a big hole in your sock, you got to go out and get the big threads and take a lot of them. And the threads are similar to the fibroblasts making fibers, exactly. So you're going to get scars on your bones too. So if you break your bones, same thing is going to happen. A bunch of fibroblasts will come to the area to knit back together, just like your broken socks, your broken bones. When you break the bone, remember there's blood vessels in there. So what are you going to do? You're going to bleed. That's hematoma formation. So you're going to get a blood pooling in that area. Eventually, we'll try to knit back together the two ends, and that's the second part with the fibrocartilaginous callus. Remember, bone originally comes from what? Cartilage. So we're going to set up the same kind of thing when we form new bone. So the first thing that's going to be formed is some sort of cartilaginous material. That will eventually then turn into what? It'll turn into bone. So step number 3 is bony callus formation. This is where your bone scar is going to be. And basically, it's just an area in your bone that's going to have a lot more fibers in it because it had to come and knit two sides together. We're also going to start forming new blood vessels and new pathways to continue to feed the bone. And at the end, when bone remodeling occurs, it's kind of like me making that clay pot. I'm going to start with extra, and then I'm going to hone it down. You're going to make extra material when you form your bony callus, and then your osteoclasts are going to hone it down. So at the end, your bone's going to heal by bone remodeling, and you're all set. So, know the steps of healing and bone fracture, figure 6.15. And then a basic definition of homeostatic imbalances of bone. So again, when I say basic definition, it's just that. If I say to you osteomalacia or rickets, basic definition of what that means. Osteomalacia means what? Bad bone. Malformed, not formed properly. Osteoporosis. Porosis. That's holy bones. Yes? So when we look at the trabeculae of spongy bone in a normal individual versus the trabeculae of spongy bone in an osteoporotic bone, not so good, yes? So remember that that's going to take cushion and pressure. Which one's going to snap really quickly? So osteoporosis is not good. We see increased risk of osteoporosis more in females than in males, and it has to do with different hormones that not only help to regulate secondary sex characteristics in females and ovarian cycles in females, but their second job is actually to help form bone. And when they start decreasing around what time of a woman's happy life? Menopause. We start to see an increased rate of osteoporosis in women. So they quote ages, 70% of American women between the ages of 60 and 70 have osteoporosis, and 70% have it by the age of 80. So what's one of the things you can do to help prevent osteoporosis or decrease the severity of osteoporosis? Women, weight-bearing exercise. Yes, make sure you build more bone, because it's gonna happen. That's just life. You're gonna start breaking down faster than you build. But if you stimulate more building, you're not gonna have problems like this. Okay? Treatment for osteoporosis, they talk about some hormone replacement therapies. Again, that's a touchy-feely area. Good, bad, we can argue over that for long periods of time. But that might also help as well. But how can you help to prevent osteoporosis or delay its onset? Build extra bone. Paget's disease is another one. Mineralization issues there. And then just a definition of developmental aspects. As a matter of fact, don't worry about developmental aspects. Again, this is a 12-week-old fetus. We see that it looks like it has a whole bunch of spaces in between its bones, but what is it actually? Cartilage. These tables are your friend. The tables are your friends. Yes? So bone marking table, know those. Common types of fractures, know those. Let's do a clicker question. Did everybody sign the sign-in sheet? Where's the sign-in sheet? Okay, pass it up this way, and if you guys didn't sign over there, make sure it gets here, because the next class is coming in soon, and you know how they get. Which of the following is not, N-O-T, not a type of cartilage? By the way, we finished chapter 6.
Oh, gee, another quiz.
Oh, gee, another quiz. When's the quiz due? 9:25 Thursday. We will finish chapter 7 as well on Thursday. I know, she's kicking butt, isn't she? So we will finish chapter 7, and basically chapter 7, I'm going to stand up here and show you where all the bones are, because that's basically all chapter 7. I might. Five, four, three, two, one. What's the answer? The answer is D. Want to do one more? Sure. Fibrocartilage would be found in which location? Five, four, three, two, one. What's the answer? Yes. So vertebrae. Larynx is hyaline cartilage, elbow, articular hyaline cartilage, external ear, what kind? Elastic cartilage. Good job. All right, I'll see you on Thursday. Don't forget to take your quiz. Make sure you sign the sign-in sheet or you're not here.